Hi, I'm Erin, and this is the radial arterial puncture for an ABG. So first of all, you need to obtain all of your equipment, and that's going to include this nice little kit, which should have your heparinized needle in it, the needle cap, the lock, and the syringe filter on the jet bed. You also need some gauze and an alcohol swab. So once you've gotten all your equipment together, what you're going to do is after you've already gotten your order, you're going to go into the chart and verify that order. While you're in the chart, you're also going to look for patient information like their bleeding time, like if they're on any anticoagulants like heparin, any like contraindication statistic, like maybe their wrist is damaged or burned, so you might have to do some extra stuff. You also want to look at their ventilator changes, if that's happened recently. If they're got normal lungs, then you only need to wait about 10 minutes, but if they're like a COPD or like maybe they are retaining air, then you're going to have to wait 25 minutes to do this. So after you've obtained the order, verified the order, gotten all your equipment together, you're going to then go into the patient's room. You're going to glove up after you wash your hands. You're going to introduce yourself to the patient, and you're going to confirm the patient, make sure it's really them. When you inform the patient, you're going to say, like, hi, my name's Erin, I'm from respiratory therapy. I'm going to be doing an ABG draw on your radial artery. You're just going to try and, like, walk them through what you're going to be doing. So after you've done that, you're going to probably get your equipment ready. So, like, opening your stuff. Put it all out. You're going to want to like loosen the cap on your syringe, not take it off. You're also going to want to make sure that either there's already air aspirated or aspirate some air into the needle. So then what you want to do is you need to find a puncture site. So the first thing is you usually want to do it on a person's non-dominant hand. So in this case, this is a right hand. You're then going to want to do the Allen test, which you close off the radial and ulnar artery, and you're going to have them pump their hand until their skin's pretty pale, and then you're going to release their ulnar artery and watch for the blood to rush back in, and that shouldn't really take longer than 7 seconds. If that test is okay, then you're going to move on to finding the pulse. So once you've found that pulse, then what you want to do is further get out your equipment. So you're going to want to swab the site. While you're waiting for that to dry, you want to put gauze out. So now you're ready to puncture. You're going to find the pulse continuously with your non-dominant hand. You're then going to take the cap off the needle, and you're going to hold it like a pen. You're going to have the bevel tipped up. You're then going to go in at about a 45-degree angle, and then you're going to warn the patient right before you stick them. So something like this is going to hurt, or this is like going to be a big poke. And then you're going to like just slowly go in until you see like a flash of red, and it should fill up pretty fast. So once it's filled up on its own, you're going to take the gauze, put it on the site, withdraw that while holding pressure, and you're going to have to hold that pressure for 5 minutes. So you're going to put your needle in the lock cap. You're then going to take that off. Then you're going to put it in the filter to get all the bubbles out. So you're going to want to like flick it or shake it to get that bubble. You're going to get all of the air out of that sample. You're then going to want to like roll it in between your fingers. And I'm going to pretend that this has been 5 minutes. Take the pressure off, or you can have the patient hold it if it hasn't been, or maybe get a nurse. So once you've obtained this, all of the air is out, the bubbles are out, you're going to want to put a label on it, and that label is going to include, like, it's an ABG, maybe your initials, you have the date and time that it was drawn, the FiO2 of the patient, If they're on a ventilator, you're also going to want to include like their respiratory rate, their tidal volume, their peak pressure, and their PEEP. So after you've done labeling, you're going to put it in the biohazard bag, and so like that's ready to go. You're going to turn to your patient again. You're going to want to make sure that they're comfortable or like answer any questions that they have. Make sure that they've stopped bleeding. So then you can take off your gloves, wash your hands, and you're going to take this to be analyzed. And once it's been analyzed, you're going to want to make sure that you document what you've done and all the results. That's how you do it.